First, I want to thank the caregivers who continue to work tirelessly on the front lines to provide service, care, love, and attention to some of our most vulnerable citizens. Those caregivers have been steadfast over an almost 2-year period to ensure that those counting on them would not be let down. As many of my colleagues know, my professional background is long-term care, and my dedication to the profession and caring for our older citizens began when I switched my major to health planning and administration at Penn State in 1976. Interestingly, there was no major or minor at that time in long-term care. Over the past 4 decades, the field has evolved, and we continue to strive to offer a continuum of services from at-home services to skilled nursing care. This morning, we are gathered to discuss the severe impact of the prolonged and insufficient reimbursement through the state's Medicaid program that pays for the care of those citizens needing skilled care. Those citizens are primarily older adults, those 85 years of age and older. When I worked in the field, my community needed to supplement the less than adequate reimbursement to deliver the highest quality service. As our speakers this morning will attest, the financial strains on skilled nursing facilities have been ongoing and exacerbated by the pandemic. Our commitment as legislators must be to ensure high quality care, including robust staffing, through a commitment to finally fund this level of care at a level that is sustainable. Our state is currently in a unique financial position to make significant strides toward this goal. If we fail to move forward in this way, we are jeopardizing the ability of this level of care to continue. At this time, it is my pleasure to introduce Chuck Quinnen, Senior Vice President and Chief of Government Affairs for LeadingAge PA. As an aside, I've known Chuck since coming into the legislature in 2011 and am thrilled to be working with him in his new capacity at LeadingAge PA, an organization I have been affiliated with since 1982. Chuck?
Thank you, Representative DeLissio. We appreciate your support. We're also honored to have Senator Judy Ward with us, who you'll hear from in a few minutes. We appreciate your leadership and look forward to further collaboration in the best interests of our Pennsylvanians. Our LeadingAge mission to advance the quality of care and services to our seniors depends greatly on the relationships we continue to strengthen here in Harrisburg. Together, we raise the voice of our more than 370 senior provider members and their residents and staff all across Pennsylvania. I'd also like to take a moment to recognize the many supporters alongside us today. We have several senior leaders from an organization LeadingAge Pennsylvania works closely with year-round, the Pennsylvania Alliance of Retirement Community Residents, referred to as Parker. Parker is comprised of residents of not-for-profit retirement communities and promotes the interests of those residents within their communities. Thank you, Nancy and all, for being here today. We're also joined by the several LeadingAge PA board members and staff of member communities and cannot thank them enough for being here as well. We're honored for the opportunity to advocate on your behalf as well as your frontline heroes and the vulnerable Pennsylvanians they serve. This morning, you will hear from 2 CEOs from LeadingAge provider members about the uphill battle they have faced to keep their doors open and beds online without sacrificing the high quality of care they provide to those in need. Just 2 years ago, pre-pandemic, LeadingAge PA commissioned advisory firm RKL for a comprehensive Medicaid funding gap analysis for Pennsylvania nursing homes. The findings were alarming. Pennsylvania nursing homes suffered a Medicaid funding shortfall of more than $631 million in 2017-18, with an average daily loss of more than $82 per resident per day for nonprofit nursing homes, and nearly $50 per resident per day for nursing homes across the Commonwealth. The results of that 2019 analysis boldly reinforced the crisis skilled nursing facilities continued to face, and that was before a pandemic that has continued to exacerbate long-term care communities with substantial pandemic-related costs, in addition to absorbing hundreds of millions of dollars in underfunding. In fall of 2021, we again commissioned RKL to prepare a Pennsylvania Medicaid funding shortfall for nursing facilities report with more recent data. And in this report, the findings are beyond alarming. They are dire. Not only did the average daily losses across nursing homes in Pennsylvania nearly double in just 2 years, but it did so while a global pandemic tailor-made to attack our most vulnerable citizens uprooted life as we know it. And nursing homes remain at the epicenter. The current shortfall across Pennsylvania is now nearly $1.2 billion, with a loss of more than $134 per resident per day for nonprofit nursing homes. We appreciate that Governor Wolf proposed a $91 million increase in the medical assistance nursing facility rates in his 2022-23 budget, but it does not come close to bridging the gap and is tied to the administration's misguided regulatory proposal to increase minimum staffing thresholds by 50%. The staffing requirements are unrealistic because providers lack funding to hire more employees. And even if they could, there remains an escalating worker shortage across the state. Funding with ties to impossible staffing ratios is not a proposal. It's a disappointing dismissal of the critical needs of our senior services. More staffing does not necessarily produce better care in many cases. Pennsylvania's Medicaid reimbursement rate has remained nearly stagnant since 2014, rising only 1% for half of the Commonwealth's providers in the 2018 budget. As a Commonwealth, we must be accountable to the most frail and vulnerable members of our communities by ensuring a strong long-term care system. We all want our communities to not only survive, but to thrive. This is not possible with a shortfall of nearly $1.2 billion in climbing. I joined the team at LeadingAge Pennsylvania a little over a month ago because I recognize and strongly believe that although we've been in unprecedented times, we have an historical opportunity right now to address the issues in meaningful and lasting ways. We have to do better. I am honored to have providers from our membership here today to share how this chronic underfunding has impacted the residents and staff of their communities, and the incredible support of forward-thinking leaders, Senator Judy Ward and Representative Pam DeLissio. I'd now like to welcome Bill Kingsbury to the podium. Bill is the president and CEO of Masonic Villages in Elizabethtown and a LeadingAge PA board member. Bill?
Thank you, Chuck, and good morning, and thank you for being here with us today. I'm Bill Kingsbury, CEO of the Masonic Villages. Since our founding 150 years ago, we have been committed to caring for Pennsylvania seniors without regard to their ability to pay. We operate 4 skilled nursing facilities, all in Pennsylvania: Warminster, Bucks County, Lafayette Hill, Montgomery County, Elizabethtown, Lancaster County, and Sewickley, Allegheny County. Our mission is only possible because of funding from Pennsylvania's Medical Assistance Program. But to be clear, medical assistance reimburses at about half the cost of the care we provide. We lose more than $200 per day for each resident who receives medical assistance. This funding gap is covered by the generosity of our donors, past and present. Last year, our donors subsidized more than $30 million of skilled nursing care provided to our residents receiving medical assistance. In addition, we provided more than $10 million of free care at cost to our Pennsylvania seniors, primarily in independent and personal care settings. Since our founding, we have been committed to providing the highest quality of care and life to our residents. We are recognized by CMS across the board as being 5-star in overall quality and quality measures, and we are proud that our facilities have been recognized by several national publications as being among the best nursing homes in the country. We have persevered in our mission through wars, recessions, depressions, the Spanish flu, but to my knowledge, we and many other quality care providers have never confronted the challenges that we face today. I wish that everyone could see what we, the members of LeadingAge, have seen over the last 2 years. Skilled nursing is a 24-hour-a-day, 365-day-a-year operation. Caring for the elderly cannot be done remotely. While many others took refuge at home, our team showed up despite their own personal risks. Because if they didn't, their cherished residents would not be cared for. Exhausted and stressed, our heroes worked long hours, month after month, without time off, often in full PPP. They endured loss, adapted to ever-changing rules, and increased demands due to quarantines and staff shortages. They comforted distressed residents who missed the touch of their loved ones, all while sacrificing time with their own families. As this crisis stretches on, they have displayed unimaginable resiliency. Despite having their enthusiasm for the light at the end of the tunnel repeatedly squelched by the emergence of variants and new case surges, they show up to ensure our residents are cared for with the love, kindness, dignity, and grace that they deserve. We have tried to find ways to mitigate the increased burdens being shouldered by our team members on the front lines, but we know we must do more for them. However, with revenue deficits resulting from census erosion and continuing substantial COVID-related expenses, our resources are stretched as never before. Perhaps no industry has felt the devastating impact of COVID more than senior living. Healthcare workers are leaving healthcare generally, but the problem is particularly severe for nursing care. Pennsylvania has chronically failed to adequately fund senior care for vulnerable seniors without the means to pay for the care they need. And its one-size-fits-all regulatory environment has missed the mark when it comes to promoting and fostering clinical care quality and quality of life. Exacerbated by COVID and workforce shortages, the situation has gone from critical to dire for many quality providers committed to serving seniors in need. Tying an insufficient funding increase to unrealistic and misguided staffing demands while doubling down on an adversarial regulatory framework will not elevate clinical care quality and quality of life. It will force senior living facilities to close or substantially reduce the number of beds for medical assistance recipients. When this happens, and make no mistake, it is already happening, who will care for our seniors in need? As a society, we can and must do better from a policy perspective. Thank you for listening. I am now honored to introduce our distinguished Senator Judy Ward from our beautiful 30th Legislative District.
Good morning. Thank you all for this opportunity. As he mentioned, my name is State Senator Judy Ward. I represent the 30th Legislative District, all of Blair County, all of Fulton County, and parts of Huntington, Franklin, and Cumberland counties. I appreciate everyone being here and shining a spotlight on this very important issue. And I also want to make sure to take a moment to thank the countless caregivers, the CNAs and nurses across our Commonwealth who work long hours trying to keep our loved ones safe, comfortable, and healthy. My mother is 99 years old, and she is currently in a facility that is affiliated with LeadingAge. And the care she gets is absolutely amazing. But they're stretched. I know they're stretched. And you can see it in the faces of the long-term care workers. Oftentimes, these nurses and staff are not recognized for their hard work to ensure that our patients, their patients and residents are happy and healthy. But the past couple years have been very hard on citizens all across our Commonwealth. Our long-term care facilities are no exception to this. They've experienced unprecedented budget shortfalls and exceptional demand due to our aging population and a global pandemic. I found it especially troubling when I read the report published by LeadingAge, and it shines a bright light on the severity of this issue. There is currently a Medicaid deficit of over $80 a day per resident. Our long-term care facilities cannot wait much longer for relief. If this unsustainable trend continues, these facilities may be forced to cut staff, remove beds, or even worse, close them all down. And I can tell you from experience and from my district, nursing homes are beginning to cut beds and take wings offline, which causes another problem in our hospitals when they can't transfer patients out of hospitals, and it creates a congestion. Myself and other members of the state legislature are currently working on legislation to further address the crisis. I have a piece of legislation currently that would direct the Joint State Government Commission to study the rising costs of long-term care, facility personnel, the expertise and experience needed for those employed, and the level of care required by residents. Our long-term care facilities need help. My hope is that our legislation is a step in that direction. As a registered nurse, I have a strong passion and commitment to ensure long-term care facilities receive the necessary funding to guarantee all patients have proper care. I understand the hardships that staff go through every day to care for their residents. I will continue to work with my colleagues in the Senate and in the House and with Representative DeLissio to provide this much needed relief to this critical industry. I thank you for this opportunity to speak on this most important issue. I would now like to introduce Jonathan Hollinger from Pleasant View Communities, President and CEO in Mannheim. Thank you.
Good morning, and thank you for coming out this morning. My name is Jonathan Hollinger, and I am the CEO and President of Pleasant View Communities. For over 67 years, Pleasant View has been a home and a place of employment for many Pennsylvanians. Like so many Pennsylvania companies, Pleasant View has also experienced pressures of supply and workforce shortages, leading to rising inflationary costs. However, unlike other businesses, we are unable to pass on these costs to our biggest customer, the state Medicaid program. 15 years ago, Pleasant View had a medical assistance rate of $178 a day. Today, that daily rate is a little more than $10 more at $189 a day. This is a mere 6% increase over a 15-year stretch. It doesn't even cover today's current inflation. In the last 5 years alone, we've seen CNA rates start about $13 an hour, go up to $20 an hour. And this isn't even enough to keep up with the competition. This is a 60% increase, again, way below the state increases in Medicaid. In the past 10 years, Pleasant View has provided over $30 million in unfunded care costs. Now, I want you to imagine that you've just completed a 16-hour shift. You worked a double due to staff shortages. Mind you, this may be your second or even third job this week that you've worked. Your nose is rubbed raw from an N95. You need a shower as you sweated through your scrubs from providing assistance for bathing. You cleaned up human waste. You changed soiled clothes. You comforted a family as their loved one declined. You were yelled at, clawed at, maybe even punched. You held the hand of a dying person while they breathed their last breath. You were exhausted, physically, mentally, emotionally. You wonder, how long can I keep doing this? You're a CNA, and this is your day. Or imagine working in retail, maybe a restaurant, warehouse, boxing up T-shirts, not quite as stressful, and you're making about the same or even more in many cases. So how have organizations like Pleasant View made the business of senior living continue over the years? Well, we've done this by having nursing and care wages at modest levels. This is no longer an option, as we have to compete with higher pay scales of the hospital systems and even non-healthcare jobs. We have charged our private pay seniors approximately 2.5 times the amount of the daily Medicaid rate, thus depleting life savings very quickly and more quickly going on to the state Medicaid program. We have used reserves that have been used or should have been used for rainy day funds, such as building improvements, repaired parking lots, sidewalks, new roofs, or updated equipment and technology. All these things have been tabled to cover these gaps. The continued underfunding of the medical assistance for senior care will cause organizations like Pleasant View to continue to lose staff and be forced to provide care to less and less seniors. You will see entire nursing wings, which has already happened, close down, and they will continue to shut down. Reductions in skilled nursing care will lead to acute care for seniors being provided at a much higher cost in the hospital systems, which are already taxed. Senior living organizations simply cannot financially afford the continued gross underfunding that we have seen in skilled nursing for 10, 15 plus years. Thank you for coming out today, and we're going to turn it back to Chuck for additional comments and questions.
Thank you, Jonathan. This morning, you've heard from Senator Judy Ward and Representative Pam DeLissio, and from senior service providers who laid out the devastating and dangerous road Pennsylvania is continuing on by not investing properly in our growing population of older adults. To begin helping to address these issues, LeadingAge PA is asking for a $294 million increase for Medicaid nursing facility rates in the 2022-2023 state budget. In partnership with the Pennsylvania Healthcare Association and the Pennsylvania Coalition of Affiliated Healthcare and Living Communities, we are advocating for the $294 million to start moving the needle in the direction of providing the critical and necessary support to our long-term care providers, and to recruit and retain a quality workforce, and to provide the needed funding to adequately reimburse providers for the true cost of delivering care to residents supported by the Medicaid program. This funding will not eliminate the nearly $1.2 billion shortfall, but it will begin to take a significant step forward to begin closing the gap. We understand that a long history of underfunding of our nursing homes cannot be made up in one fiscal year. We began behind, and we haven't caught up yet. But we have the opportunity now to reverse this trend and be accountable to the most frail and vulnerable members of our communities by ensuring a strong long-term care system. Again, we want all of our communities to not only survive, but to thrive. It's time to finally address these issues in meaningful and lasting ways because our seniors deserve better. I encourage you to read the full Pennsylvania Medicaid funding shortfall for nursing facilities report, which is now available, and that includes a breakdown by counties. Also, please reach out with any questions or media requests, as our communications team would be happy to coordinate.